The past few weeks have seen Qoki's and Lavyakazi trending following a revelation that the group of Zimbabwean women in the diaspora are millionaires after investing so much in immovable property. What remains amazing about the women, a majority being healthcare workers, is that they have a philanthropic side which has brought smiles to hundreds of households in Matebeleland since the inception of the organization. Founded by Ms. Sithul Chuma, who is based in the United Kingdom, Qoki is a member-driven women's organization that utilizes the power of social media to address challenges faced by members and their communities in the diaspora and country of origin. As their name Qoki, which is an Ndebele word meaning knocking, members of this organization have not only knocked their way into society, but they have indeed made their presence felt. The organization has grown in leaps and bounds and now has members in South Africa, Canada, America, Australia, United Kingdom, Ireland and Zimbabwe. One of the senior directors, Bridget Dube, said theirs was to show the rest of society that anything was possible and that they could not only uplift themselves but in the same vein uplift the entire society. Some of the development projects funded by the organization are Qoki Zimbabwe Hospital Project, Qoki Chalacho Disaster Support, and Qoki Various Support to individuals with compelling needs. Besides the flashy mansions and lucrative business ventures they have engaged in ever since they started the organization, the over 5,000 women have also given back to different communities. Since more than 95% of them are in care work, their first charity project dates back to 2017, a few months after establishing Qoki, when they started the Blanket Project to boost hospitals in Matebeleland. The Qoki Zimbabwe Hospital project has so far seen the donation of more than 1,300 blankets to 14 different healthcare centers in Matebeleland, which the women started by contributing at least £5 each monthly. These include Sipipa Clinic in Chalacho, St. Mary's Hospital in Hwange, Binga District Hospital, Mkei District Hospital, Brunipig Hospital, St. Luke's Lupane, Mpilo Central Hospital, Gwanta District Hospital, Mafisa, Binga, Inyathi District Hospitals and Thorngrove Infectious Diseases Hospital. This was after concern was raised over shortages of blankets, especially in rural areas, where in some instances patients were forced to carry their own when seeking medical attention. Qoki also donated to Chalacho District flood victims of 2017 blankets, food, tents for shelter and medical health care support. Qoki Chalacho disaster donations were made to assist villagers that lost their homes. In June 2019, Qoki opened Qoki Medical Healthcare Center in Bulawayo, with more branches expected in other cities in future to improve access to health, as there are limited healthcare centers. Part of Qoki beneficiaries include triplets from Hwange whose mother bled to death after delivering them in 2019. Qoki adopted the triplets and has been supplying their needs. Another baby from Fig Tree whose mother died during delivery was adopted by Qoki after a picture of his 63-year-old father went viral. In the picture, the boy, who was aged 10 months then, was being pushed in a wheelbarrow while the man was doing his duties as he no longer had anyone to look after the baby. Ms. Chuma said Qoki Charity was the organization's way of appreciating different communities who played a part in raising its members. As we grow as women, we continue to give back to the community and the people who have helped us become who we are today. We have a tendency to assist the less fortunate in our community, said Ms. Chuma. Every brick contributes to development. We can construct a nation together. Never underestimate the power of a small group of thoughtful, determined citizens to change the world. We support a lot of orphans who've lost their mothers during childbirth. So far we've supported 8 babies including triplets. As concerned healthcare workers, every year Qoki donates food to Mpilo so that the kitchen staff can make a wholesome Christmas meal for all patients who will be admitted on the day. When COVID-19 broke out, Qoki responded swiftly by distributing food hampers to affected families both in Zimbabwe and South Africa during the initial lockdown period. Since then, the organization has rallied behind the less privileged whose plight was worsened by the global pandemic. Qoki also raised funds to buy personal protective equipment for Bulawayo hospitals, which was distributed last year. We have a dedicated team of intercessors, and this group started when we had a lot of our members calling admins about their illnesses, family illnesses, COVID-19 related symptoms, anxieties and stressors at work due to COVID-19. These women's role is to pray for Qoki ladies and anyone in general that we get to know and are struggling with anything or are in hospital. This is a dedicated team. They give their evenings to interceding on our behalf each and every day of the week, she added. When tragedy hit Mpilo, doctors who lost property when their residence was gutted by fire, Qoki was one of the organizations that extended help by donating food for the affected 41 families.